Did you take any medicines today? Were you using any drugs?
Dr. James Sirleaf is the Emergency Department Medical Director for Midtown Medical Center in Columbus. He's seen numerous patients rushed into the ER after overdosing on drugs, sometimes bringing them back to life with a drug called naloxone. It reverses the effects of opioids, everything from prescription painkillers to heroin.
A lot of people say, oh, well, I survived, and they go back into their communities and amongst their friends, and a lot of times we've seen people come in multiple times for these overdoses.
Naloxone is controversial, though, because some wonder if it's enabling addicts who overdose.
I remember being just extremely high and blacking out. I had already stopped breathing numerous times. Your fingers turn purple, your lips turn purple, and you're slowly dying. I'm not proud of this fact of saying that it's happened more than a few times, but it has.
Overdosing on opioids and heroin on the brink of death 10 times, Christina Parnell told our sister station, Fox 6 in Birmingham, she decided to get help. But on her way to the treatment center, this addict used one more time, ending up in the hospital. And once again, she was brought back to life in a matter of minutes.
It's almost like if you're in a deep sleep, and then all of a sudden you just wake up. And I started shaking uncontrollably.
The drug that saved her every time, naloxone or Narcan. Because of heroin overdose deaths doubling nationwide, 140 in Jefferson County, Alabama in 2014 alone, U.S. Attorney General Eric Holder has called for more police officers and sheriff's deputies to carry naloxone. Close to 20 states, including Georgia, are following that recommendation.
With overdosing, they stop breathing and go down into the 80s.
Pop superstar Prince, who died last month, was reportedly taking Percocet, which contains the opioid oxycodone, for hip pain. Sources close to the legendary musician say a treatment with the anti-overdose drug naloxone saved his life a week earlier.
Naloxone came into effect and has saved probably millions and millions of people around the country.
The alternative to not using it? Brain damage and death within minutes of an opioid overdose. When naloxone is injected, it can work within just 5 minutes and essentially wakes up the person that overdosed on narcotics, but it does not replace emergency medical care.
I joke about it, you can almost revive the dead because people are they're almost blue, and you give them Narcan and they wake up of this communist sleep.
While many physicians admit the majority of drug overdose victims will relapse, their job is to do no harm. Then it's up to the patient to get clean.
People have to also take responsibility. Is this something that they want to continue?
Not only do doctors use naloxone or Narcan here in the emergency room, but police and medics from all over the nation and here in Georgia also use it when they respond to emergencies.
Across the U.S., some states allow or encourage schools to stock the heroin overdose antidote naloxone. Pastors, family members, and friends of addicts are also receiving training on administering this drug, which would be prescribed to the person in need through a new University of Alabama at Birmingham program.
This is my son, Aaron Sims. He was 20 years old.
Immediately after he passed away, I was fortunate enough to be part of a pilot project where I learned about naloxone and I learned about the lack of resources.
Justin Phillips' son died from heroin addiction in 2013. Named for him, Aaron's Law was signed by Indiana's governor just last year, allowing Hoosiers to get a prescription for naloxone if they believe someone they know is at risk for an opioid overdose. Prior to that, only emergency workers could carry that drug. His mom's organization, Overdose Lifeline, provides naloxone to first responders, families, and caregivers.
Sometimes we give them Narcan, but the drug is so much in the system that sometimes we have to breathe for them.
And so you generate a tolerance where you need more and more to feel the same way, and there's no ceiling.
In a workshop at the National Prescription Drug and Heroin Abuse Summit in Atlanta, this health scientist for the Centers for Disease Control and Prevention, Dr. John Zibel, was one of hundreds of experts talking about the destructive transition between the two kinds of drugs and how to prevent overdoses killing so many people nationwide.
So we really have to get people that aren't becoming dependent on opioids to end that even risk for heroin.
Former Columbus drug dealer and heroin addict Joshua Dudley barely survived his habit, wishing naloxone could have saved more.
I had half a dozen friends, you know, that have shot up heroin and died, you know, and there was times when I was like, you know, that could be me.
We've talked pill mills, victims, and saving addicts' lives. Now in part 4 of my Ending the Epidemic special reports, see what's being done at the state and community levels to battle prescription drug abuse.